A very good evening once again. You're watching News 9 Facebook Live with me, Adarsh Vepachedu. More and more research is beginning to indicate that those with blood type O may have a low risk of COVID-19 infection. Well, if your blood type is O and you manage to catch the infection, there is lower likelihood of severe outcomes, including organ complications, and that's what the research has said. For these findings, the research team compared Danish Health Registry data from more than 4,73,000 individuals tested for COVID-19 to data from a control group of more than 2.2 million people from the general population. Now, among the COVID-19 positive, the researchers found that fewer people with blood type O and more people with A, B and AB types. To tell us more about what this research could mean for us, we have with us renowned oncologist from HCG Cancer Hospital, Dr. Vishal Rao, on the phone line. Many thanks, sir, for speaking to us. My first question, it all seems to be about the severity of symptoms that you experience. While the study results suggest that people with blood types A, B or AB may be more likely to be infected with COVID-19 than people with type O, it is also saying that there is an increased risk of severe clinical outcomes of COVID-19 infection. I want you to tell our viewers as to why there is this difference between blood groups when it comes to the severity of symptoms.
Thank you. At HCG here, we have set up our plasma bank, and we've till now had about 800 plus plasma donations, and we've been looking at the blood groups of both the affected people and the plasma donor here. So our hematology team and the plasma bank team that's been looking at this has had some very interesting findings. What we've also found is that lot of the patients with donors had blood group O. Now that clearly indicates that these group of people who got affected with O were people who were not critically ill. Okay, and when we took their detailed history. Now there's been a lot of interesting research on understanding why is it that certain blood groups are more prone for a more severe infection and certain blood groups have less risk in terms of susceptibility. So the most interesting data for this comes from China again and was recently published in October itself in one of the reputed Elsevier publications internationally. This is what we call as a systematic review or a meta-analysis, in which they actually analyzed about 31,000 odd samples and looked at what is the susceptibility and the odds of infecting. And this particular study is one of the best studies we have right now that tells us that the blood type A may be more susceptible to infection, while blood type O might be less susceptible to infection. Now, this is a very generic thing that they have pointed out, but interestingly, the reasons for that is still not very clear. And I'm saying that there are a whole lot of hypotheses that are being laid out, including some molecular hypothesis, which is based on the way the antigens are binding. So the way the COVID antigens are binding to certain blood type antigens could be the reason why they have a better access and entry into the human body, why they have a better replication or their metabolic rates are being done. And those are the kind of postulations that are being done today. We don't have conclusive proof to say why a specific blood type could be the single most determining factor. But what we are understanding from experts across when we are discussing is, it's not just one single factor. There are several other factors also, but this could be a contributing significant factor.
Okay. So, Dr. Vishal, bottom line is we know that it could be the case where, if you're blood type O, then you could be lesser susceptible to COVID-19. You could experience, not so severe symptoms also. But while we are trying to find out as to why this is the case, before that, couldn't this study really help our health professionals tweak their response while dealing with, patients? I mean, if you know that a patient is blood type A, B or AB, you can somehow estimate the severity and then prepare accordingly for any future symptoms like, say, lung or kidney damage, which the study has indicated will be more likely in the said blood group. So could this really help us tweak the way in which we manage patients, in which we, respond to patients?
So as of now, if you look at it, there is a lot of discussion going on among the clinical experts and ICU teams to understand can we differentially respond. But I think the bottom line here, I'm telling from our perspective is, we've been looking at understanding if certain blood types need to be kept for plasma as an emergency measure, because we're finding, for example, shortage of AB blood group for plasma, which is not easily available, and in times of emergencies, we are finding difficult to get donors. So those are the kind of implications we are keeping on one side. And the other side, currently, the intensivists and the pulmonologists are discussing on, is there a strategy that they need to develop? But I don't think, as of now, there is any conclusive thing that they are looking at in specific targets.
Okay.
But the most important thing that they're looking at is if there is a particular blood group, for example, such as the A blood type, which they know are more susceptible, or the AB blood group, which has got a significant higher risk of COVID-19 severity.
Yes.
They are talking to the families to say to preemptively understand and improve preparedness in terms of intervention that should be done earlier, whether it's a remdesivir, a plasma, or an ICU intervention, to be more aggressive. That is something that they've all been looking at.
Okay, so there is work that is already being done, like you're able to identify what blood type a patient really has, and then, be able to react to it better and be able to take care better. Now, looking forward, Dr. Vishal, what according to you does the future of fighting diseases and pandemics such as this look like with the help of blood groups? There seems to be plenty of scope in this area. How do you see matters panning forward?
I was talking to Dr. Sachin Jadhav, the group head for our center, who's a hematologist, and our immunohematologist, Dr. Ashish Doot. I think the key focus that they've all been talking about is how is genetics, how is research going to play a pivotal role to understand susceptibility is going to be a very, very important determinant to look at future targets in such kind of pandemics. And I'm glad you brought this up. See, one of the things that we did way back in March was to prepare for the plasma therapy. And today we are at about 800 plus plasmas that we've given. Now showing how important this is. To go one step ahead, we've been talking to global authorities like the Emory University in Atlanta to look at how can the blood groups give us the answer to codify the information to finding the cure for these diseases. Because the coded answer in some of these blood groups, understanding why they are able to fight the infection better versus some blood groups are not able to fight it, could also hold the formula to understanding, the Da Vinci Code to understanding how are we going to look at specific targeted therapies for the future pandemics.
Okay. Well, many thanks, Dr. Vishal, for joining us and for sharing with us your insights on this new study that has, in a sense, thrown light as to how there could be a few blood groups that could be more susceptible and that could be more vulnerable to COVID-19, and as to how, when it comes to a few blood groups, even when it comes to the symptoms, you could see more pronounced symptoms. So yes, there is still a lot of research that is being done at this point in time. We'll have to wait and see as to how that really progresses. But yes, targeted therapy based on blood groups, not just for COVID-19, but for diseases that we may encounter in the future, could really be an actual thing looking forward. If you've liked the information that we've shared with you this evening, do not forget to like, share and subscribe to News 9 on YouTube, Facebook, Instagram and Twitter. Many thanks for joining us.